Hey, everybody. Welcome to Hormonally Speaking. Today it is kind of gloomy outside right now in Asheville, but I have one of my favorite, sunniest people here on the podcast today. So excited. So, just a little bit of history before I tell you about her. She is an incredible acupuncturist. I got to start with that. And she was so helpful for me in my process of healing after my emergency surgeries. I feel so lucky that she was in my life and showed up in that way after those surgeries, because if you've ever done acupuncture, then you know how powerful it can be with really getting to the root of the issues that are going on with you that, may not um, be tackled correctly in some of the other ways. I don't know if tackled correctly is the best way to say it, but the lingering things, especially the chronic things, right? And I had been lucky enough to be introduced to acupuncture in my 20s, so I knew that it could be really helpful. But the type of person that does acupuncture and the other things that come along with acupuncture, which we're going to talk about today, it's really important, right? And she's got that healing touch. So her name is Ashley Kuper, and she is a nationally licensed acupuncturist. She received her master's degree in Chinese medicine from Taoist Traditions in Chinese Medical Arts in Asheville, North Carolina. Her areas of expertise encompass pain management, fertility, women's health, digestive disorders, psycho-emotional issues, preventative medicine, cosmetic acupuncture, and overall health maintenance and stress relief. Ashley incorporates many modalities into each treatment, including acupuncture, herbal medicine, food therapy, essential oils, gua sha, and cupping. She is committed to using the tools that she has learned to make her community a happier and healthier place. Welcome, Ashley.
Thank you so much. I'm so happy to be here.
I'm so
I'm
excited.
obviously a big fan of you as well, and I've loved listening to your podcast and all the amazing guests you've had, and I've learned so much through it, so I'm really honored to be on this side and nervous.
Yeah.
I'm really excited to talk about one of my favorite subjects, and yeah.
Yeah. Well,
Mhm.
I definitely concur that we've had some really amazing guests on here, and I'm really glad to add this element to the mix because, I think sometimes people think about acupuncture, I think a lot for like, if you've hurt your leg or if you have maybe allergies and things like that, but they don't necessarily think about hormones and acupuncture, right? And so we're definitely going to dive into how that can help, how acupuncture and other forms of traditional Chinese medicine can help with hormones today. But before we go there, let's start with, what is traditional Chinese medicine? Where did acupuncture really come from? Because I think a lot of people know about it, but don't necessarily know the history of it.
Yeah. So, Chinese medicine is a very rich and ancient medical system. We've been treating health conditions for over 3,000 years. And there's some really,
Crazy.
it's like when you really think about how old it is, it's
Mm-hmm.
how we knew or they knew the things
Mm-hmm.
that they knew is pretty fascinating. So I studied classical Chinese medicine. There's different types of schooling. There's traditional Chinese medicine, classical Chinese medicine, 5 elements, and there's some crossover in all of them. But with classical Chinese medicine, one of the things we really study are the classics. So the textbooks that were
Mm.
written thousands of years ago.
Wow.
And one of the ones that are the first one, that's the first recorded one, is actually called the Huangdi Neijing, or the Yellow Emperor's Canon of Internal Medicine. And it's so
Oh.
cool because it's literally was written over 2,000 years ago.
Mm-hmm.
And the book talks about, it's actually between the Yellow Emperor, Huangdi, and his physician, Bo, who was
Oh.
an acupuncturist. And they start talking about questions as to like, why is it that people are dying or having illnesses, or how is it
Mm.
that we've strayed away from living in harmony with nature? Or they introduce topics like the cycles of 7 and 8, which we talk a lot about with hormones, as to like our reproductive and challenges that come up for women every 7 years or men every 8 years. So
Mm.
there's these really cool topics that get introduced. And then there's also parts of the book too that talk about acupuncture points, exactly where they're located, the functions of each point. And the part that fascinates me is that these books also will talk about our cardiovascular system, the weight and shape of organs, like how different vessels flow to and from the heart, things that in Western medicine we didn't really know until the 16th century with like more
Right.
sections and things. Like these things are written in these books, so it's fascinating. And it's really old, and it's one of those things that the first acupuncture needles were made out of stone. They would like refine stone.
Whoa.
And then slowly things evolved, and they started incorporating metal needles and gold and silver, because each one has its different properties. And then they have the stainless steel needles that we use today.
Mhm.
So it's old
Mhm.
and vast. But one of the things that I love about it too is that the excellence really of Chinese medicine is that you have to immerse yourself in that and know the
Mhm.
empirical knowledge and know the history, but it also, you simultaneously respond to what's going on today, and like
Mhm.
practically and mindfully, in the way that like we treat what we see. So even
Mhm.
though obviously our society has changed in 2000 years and some of our diseases are different, it's one of those things that the theory behind it applies to what is going on today. And
Gotcha.
it's cool because there's a lot of research now being done with
Yeah.
acupuncture.
Yeah.
And there's a lot of, there was a research done in the 1950s by a German doctor who actually concluded that there was these like electroconductive pathways in the body that actually mirrored the meridians that we
Mm.
study. And he
Mhm.
noticed that if the conductivity was either too high or too low, there was pain along that channel. So it's
Mm.
things are starting to match what we
Yeah.
believed for years.
Yeah.
And I'm grateful for research, because a lot of the times when patients ask me how it works, I do describe it in the language that we use in
Right.
Western society. Like it reduces inflammation and improves circulation. It
Mhm.
can block pain receptors. It's helps with you know epinephrine and like different
Mhm.
neurotransmitters. Like there's all that verbiage, but really we see things so differently. And even though I'm
Yeah.
grateful for the research, I also, in some ways, I do feel like it waters down the richness of like the way we explain it. So
Yeah.
I think we
Yeah.
have to be able to do both, but
It's interesting because I remember, I lived in California for 10 years, and I believe it was either the first guy that kind of brought acupuncture to America or to California. I think in the 60s or 70s, like there was the clinic there that he, in Chinatown, that he had started. And I remember going in, there was pictures of him with different like lawmakers, from that time.
yeah.
And maybe he helped to get it legalized or something, whatever, in California. I
Mhm.
can't remember what it was, but, it was this interesting thing of, for so long, it was a pseudo science or whatever you want to call it to allopathic, medicine, or to Western ideas of what is really medicine, right? And then we started to be able to do our scientific method to quote unquote prove it, right? And
Mhm.
I remember learning about this too in my master's program. In I just did like an intro class, and it really brought it very clear to me, like how we are, I don't want to say like obsessed, but the idea of kind of like the white is right
Mhm.
aspect, right? And how the scientific method can really fit into that white is right. And we're smarter and more intelligent and more, scientific and clear in all of these things in our ultimate scientific method. And yet we have these cultures, both, Chinese, traditional Chinese medicine, and Ayurveda, that have been around for literally thousands of years and have been done on millions of people. And just because it wasn't done in this traditional scientific method, which has only been around for like less than 200 years, it's like it was this invalidated thing. Suddenly we can start to put it through the lens. We figure out how to study acupuncture through that lens. So now it's valid. I remember seeing that shift even that whole time I was in California. But, I mean, it is what it is.
Mhm.
Here we are, at least people now understand how helpful it can
Yeah.
be.
But it's so tricky too, because even like they'll do research where there's like sham acupuncture, where they'll put a needle and not an acupuncture point, but we
Okay.
have points all along like what are called Osher points, or points like off of the channel that can
Mm-hmm.
just be tender. So it's one of those things that it is being put into the lens of research in
Mm-hmm.
Western medicine, but like I still sometimes read articles that like, they're like, oh, it's totally doesn't work. And it's one
Yeah.
of the things that, it is a form of energy medicine. It is a form of science medicine. It's a form of, and for some people it works amazingly. And for other
Mm-hmm.
people, just like everything, you kind of have to find what works for you. But
Absolutely.
it's always fascinating to,
Yeah.
yeah.
To dive into that. So you mentioned, and I thought this is interesting because I've never heard about this, like the every 7 years for women and every 8 years for men in terms of hormones. Can you
Yeah.
tell a little bit about that?
Yeah. So and that's to piggyback on kind of what we were talking about, Chinese medicine is not very linear. So it's
Mm-hmm.
one of those things that it's like, and to study it, it's super frustrating because you're like, it's this,
Right.
and then there's this that kind of counteracts what we just learned, but it's both and none. And you're just like, what? So, in some books, they say cycles of 7 and 8 that women go through these transitional important cycles.
Mm,
Some people interpret it as actually cycles of 10 for both. And, it's
mm,
one of those things that like in China, when you're born, that's your one. So there's also that,
mm,
is it really 7 or,
right.
but it's kind of cool because, there's 7, 14, 21, 28 for women, that there's these major shifts that happen in the body. So,
Mm,
7, we go from like being a little one to like
mm-hmm,
starting to almost know our self and
mm-hmm,
know the world around us. And 14, obviously, with like menstruation and
mm-hmm,
hormones. And
mm-hmm,
so there's some psycho-emotional aspects to it and
mm-hmm.
spiritual changes, and then also like physical changes through like 35, technically, when we are in the dissension part of our phase, or
Right.
yin starts to deplete, perimenopause, things like that. And each cycle is also associated with an element. So like, it's cool because you can kind of do these elemental formulas to kind of help women through these phases or changes in their life. So it's
That's
pretty cool.
that's fascinating. And so with the guys, because their hormones are kind of more steady,
Mm-hmm.
there's still some changes that you're seeing every 8 years or
Yeah, because
so?
it's not necessarily just hormone changes. It's
Mm-hmm.
basically like shifts in
Mm-hmm.
internal and external that are happening.
Gotcha. Gotcha. That's pretty fascinating. I love it though. I mean, it's funny though when you were saying like you'll learn this and then you'll learn the exact opposite. And I feel like that with functional health stuff too sometimes, because I mean, the more you learn, the more you're like, oh my God, there.
Especially hormones. It's just like,
Yeah, yeah. I mean,
yeah.
all of it, and the more that I mean, obviously, the more that studies are coming out, and the more that you dig in, and every organ, because hormones are so dependent really on the different organs in a lot of ways too, so every organ you dig into more and you like learn how this impacts that thing and you're just like, oh my
And
God.
the relationship between the organs and how they're, all of
Absolutely,
that.
absolutely. We are holistic beings, so what are
That's
you
one
gonna
of
do?
the things I love about, in school, you learn and you're like, oh, this means this. And, you're
Hmm.
going to meet a patient and they're going to have these symptoms and this pulse and this tongue. And then in practice, obviously, it's like, well, it's this and this. And we're complex beings and we're
Yep,
not, we have a little bit of lots of things. And that's a beautiful thing, and it's not like there's
absolutely.
a lot wrong with us. It's just that we are complex and, magical, the things that we can do and try.
Absolutely. And we got to just roll with what what shows up to, right?
Yep.
So, can you tell us a little bit more about how hormones kind of, show up and how you work with them in Chinese medicine?
So there's a lot of different ways that we can work with hormones. There's different channel systems. There's like the primary meridians and these then like 8 extraordinary channels that are formed in utero, and those can have a lot to do with like constitutional issues or
Okay.
there's a lot of different things that we can do with hormones. But one of the ways to simply understand, and even though it seems simple, it's again also very vast, is Yin Yang theory. So
Mm-hmm.
we all know a little bit about the yin yang and
Hmm.
I remember my little 90s choker I had.
Totally.
I know, I'm not, here I
Yep.
am.
From
Uh,
Claire's Boutique or whatever. Yeah.
yeah. But so we learn yin yang theory to really understand the world and ourselves as well. So not only like our physiology, but our pathology. And
Hmm.
so yin yang theory is, yin is everything that is substance in our body. So we're looking at our hormones are yin,
Okay.
blood is yin, our synovial fluids that keep our joints lubricated, or our fluids that keep us lubricated. Vaginal dryness is, a form of yin deficiency. So there's
Okay.
these, yin is everything that's cooling and substance and grounding and rest. And then in relationship to that, you have yang, which is more like our metabolism, our circulation, our circadian rhythms, everything that's more warmth and movement and action. So a lot of what we look with hormones and with everything, we're trying to promote balance in the body, is that we're looking at the relationship between yin and yang. So it's one of those things that, some of us are more yin or yang in nature,
Mm-hmm.
and we need to do lifestyle choices that kind of help balance that out. And it's kind of cool because so for example, and a lot of what we look with yin and yang is that, I don't think they're ever in perfect balance, because yin and yang are they're interdependent, they're codependent, they transform into each other. So you can't have one without the other. And the moment that one is affected, it's going to affect the other. So it's,
So for example, if you had yin deficiency, does that mean that you're having too much yang going on?
so that's a great question. So it might look like you have too much yang. So something like yin deficiency might be that you run really hot, you're having night sweats or hot flashes, or you have dryness, you have insomnia, restlessness, anxiety. So it might look like there's too much yang, and you can technically clear yang or like try to dissipate it, but that won't get you anywhere. What you really have to be doing is bringing the yin up so that the yin and yang are balanced. And same thing with yang deficiency, it might actually appear to be more like yin, like you have a lot of cold or weight gain or brain fog, but it's really that we have to bring that yang energy up. So it's a constant, beautiful dance between yin and yang. And for the hormones, our menstrual cycle is a beautiful ebb and flow of yin and yang. So we actually split up the cycle into 4 different phases, and they're not equal phases, but we have the blood phase, the yin phase, the qi phase, and then the yang phase. So through each part of that menstrual cycle, we're trying different treatment strategies to move blood, to then nourish the blood, to then move qi stagnation to help with ovulation, and then warming the yang. And it's, it's interesting because we've talked about this in the past with like estrogen, progesterone. Estrogen is yin, progesterone is yang. So it's similar in looking at it. Like I would want to boost yang in the luteal phase.
Right.
But it's not always like somebody might be, super yin deficient, and I would want boosting yin all throughout. So but that's one of the ways that we really work with hormones is kind of figuring out, is it yin excess, yin deficiency, and that will help us a lot with that hormone balance.
So interesting, because I was thinking as you were talking about both the hormones and before with yin and yang, like if I think of it from, the functional perspective, then, if you had a yin deficiency, like you said, you're, basically bringing up the yin, it's not about bringing down the yang. So like a lot of times, I think yin deficiency, maybe, in a woman's life, there's a lot of stress happening, right? And that's creating that yin deficiency. I look at it as, fatigue, different things like that. And people think, oh, well, I want to like maybe take this thing to make my body, my metabolism faster or something like that. When in actuality, the main thing you have to do is bring down your stress. And so basically you're kind of, feeding to balance out that yin deficiency by kind of pulling back or doing calming things. And, this lens for me would be getting you into your parasympathetic nervous system. That might be kind of like, aligned with yin versus your sympathetic nervous system would be aligned with yang. So it's pretty fascinating to kind of
it's
think
cool
about it that
too
way.
how like so many of our lifestyle choices can either help bring us back into balance, and that's one of the things that as practitioners we try to educate. But most of us, like, our lifestyle choices are actually just progressing our imbalances. And it's people who are yin deficiency a lot of the times tend to be more like go go go, or like over exercise, and it's like and sometimes to bring that into balance, it's like actually you need to rest, or you need to do like more yin yoga
Yeah.
than
You
vinyasa.
gotta be doing Pilates and not hit, my friend. It's not
Exactly.
working for you right now. Yeah, absolutely.
And it's just, yeah, it's
Yeah.
about balance. And, we're all always kind of striving for that, but
Yeah.
it's,
And we're in such a young kind of world, right? And women sort of pushing their bodies in ways that the bodies aren't necessarily I don't want to say they're not made to do, but it's just not for, the good of the health of the individual, because we're just not having that time. Just like, being in the sympathetic versus the parasympathetic. It's like we all need to be spending, including men, it's not just women really, but more time in our parasympathetic nervous system while we're spending a good chunk of our time in the sympathetic. And that's where, a lot of the breakdown of the body starts to happen,
yeah.
because parasympathetic is really rest and repair time,
Mhm.
so I could see like filling it up on that yin. Just I can see that like connection in my brain. So going back to the hormones thing too, so like that kind of would look like follicular phase, when you want your estrogen to be highest, you're supporting yin at
Mhm.
that point. And then what did you say right around ovulation?
So during so the 4 cycles are during your actual menses.
Uh-huh.
That's the blood cycle. So that usually
Okay.
only lasts for however long you're bleeding,
Right, 5-ish
four or
days.
5-ish
Mhm.
days.
Mhm.
So that we're moving blood. Then we move into the yin part, which is
Mhm.
right from after you stopped bleeding
Mhm.
until ovulation. That's
Okay.
the yin part. So that's when we're actually looking at banking back your yin, like you just lost
Mm.
blood. When we're working with fertility, that's a really important part to like nourish the yin, because that will help with follicles, that will help with
Mhm.
cervical fluid, all the things that we want for fertility. But even without fertility, we're still wanting to nourish the yin during that part, to then
Mhm.
a lot of the times, like, problems in the luteal phase or PMS have a lot to do because that yin wasn't able to
100%.
bank back. So,
Yeah.
and then ovulation is the chi phase. So that's when it's a really transformational part, because there's 2 parts of the cycle where it goes from yin to yang and yang
Mhm.
to yin.
Mhm.
So ovulation goes from yin to yang. So it's like that
Mm.
spark that needs to happen.
Right.
So you really need to move that chi, and that's when some people will get like, some cramping or even
Yep.
some breast tenderness or changes in their mood. And that
Yep.
has a lot to do with that chi dynamic. And then from ovulation to your menses, which will kind of like the luteal phase, is all the yang phase in
Mhm.
Chinese medicine. So that's when
So
we're having like implantation, or we're just really working on like people even without with amenorrhea, or who are not getting their cycles, like, you know,
yeah.
creating that warmth and movement. A lot of and we might talk about this later, but like one of the common issues with hormones sometimes is what we call cold in the uterus.
Mm.
And it's reminds me of what we were talking about too, with research versus like almost grandma
Mhm.
medicine,
Yeah,
where
yeah.
grandma would be like, oh, don't sit on a cold floor,
Yeah,
and it's
yeah,
like
yeah.
actually something to that. Like there might not
It's
be
legit, yeah.
much.
Can't make any money off of it, but
So yeah, so that would
yeah,
be, there'd be like warming and
yeah,
helping with either implantation or
yeah.
getting ready for the
W
cycle.
What's interesting about that is progesterone is a warming hormone, right? So
Mhm.
basically, women will know that they have ovulated because their temperature jumps up right after ovulation, and that's due to progesterone coming in, right? From the
Mhm.
corpus luteum. And so you'll see usually an increase for a few days, if you're continuing to take your temperature first thing in the morning, and then hopefully it levels out. This is the goal in that luteal phase, to kind of stay high for several days, and 7 to 10 days, and then basically it drops kind of pretty fast in the 2 days right before your period starts, right? Both progesterone and estrogen drop, and then that's what kicks off your period. But when you were talking about ovulation, that, I was thinking about, like, you were talking about the chi, and that's another time people don't realize, like, your hormones drop, right? Or your estrogen and your FSH, which have been high right before ovulation, they quickly drop. And that's usually when people are feeling some of those symptoms come up, right? Because it's
Mhm.
that hormone kind of like pull back or whatever. And so I can see how really supporting that chi moving during that time can help get rid of that sort of the stagnation that can happen when hormones drop,
Yeah.
essentially.
Mhm.
So cool. I'm like, I love putting that together of how, both systems kind of really line up in that.
Yeah.
Um, and yeah, and partly I was just graphing this week one of my clients' cycling hormone panel, which I love the Dutch and the information you get from it, but it's just a 1 day hormone test versus this is a saliva one that picks out 11 days throughout the month, and you really get to see where people, where their hormones are peaking, where they're low, and based on what it like quote unquote should be or what is optimal, and
Mhm.
then what's going on with them. And you can really see, oh, okay, this is actually, if your follicular isn't working right, then you're probably your luteal's not going to. Even though this client was very interesting, her estrogen was definitely on the lower end, like the
Mhm.
entire, first the follicular phase, and her FSH was low too. It was low going in, and it kind of stayed low. But she still ovulated. Like I was very surprised that she ovulated. So this is how amazing the body can be. Like, she's not bottomed out in estrogen, but she's definitely lower than needs to be, and
Mhm.
still somehow the ovulation thing happened. So she gets that progesterone, because if you don't ovulate, you won't get your progesterone. So she got the progesterone, but then, as with many women, it dropped too early. And that's when you start to see, those PMS symptoms. But it's such a symphony, right? Of how this all,
Well,
like, it's all
yeah,
interconnected.
yeah,
And,
yeah.
another thing is, like, as soon as your estrogen and progesterone drop right before your period, that kicks off, your FSH. Like
Mhm.
basically your pituitary is like, gotta get things going. We gotta like get another egg in here, because this y'all didn't fertilize this one. It's time to go again,
Right
and
back
like,
at it.
yeah, and it's like it's that drop that actually triggers the FSH, which will trigger the estrogen in for your next cycle. And so if you don't have enough, of that FSH going on, then you can be in trouble with the estrogen. So yeah, it's just such a beautiful concert. It's amazing to me. So
It is. I know I can it's beautiful. And
yeah.
it's like I love how, like, when you were talking about that one client you've been working with, a lot of what we do too in Chinese medicine is kind of taking the individual into account. So even though there's these ranges, let's say that we want the estrogen to be in this, or
Hmm.
a lot of, like, hers just might be lower,
Right.
and that's, it's, she
Right.
can ovulate, or she can still do, maybe there's symptoms that we can work on. But
Hmm.
again, I think one of the beautiful pieces is that individuality, that, we all kind of operate a little bit different.
Yeah, 100%. I'm glad that you brought that up, because I think that's the downside possibly of testing sometimes, is this ideal and the optimal ranges and things like that. And just because you're not in the optimal ranges, like, doesn't mean that anything's, necessarily wrong with you, or even that it shows up symptomatically. So you have to really, that's what's so important about working with somebody that's gonna not just look at the tests, that they're also gonna, bring in the symptoms and combine those.
And even just
um
movement of it, like, as long as it's,
mhm,
moving in the right direction, like, you
mhm.
might get to, like, that perfect range, but at least it's like, oh, look at that, it moved. And I think
Yeah,
that's huge, with
yeah. So, what are some of the hormone issues that you see the most and that you deal with the most often?
um so many.
She's
I
like,
mean,
all of
like,
them.
I do work a lot with fertility. That's one of
Hmm.
I love working with women trying to get pregnant. I'm myself on the fertility journey, and I
Hmm.
can relate with the journey aspect of it.
Hmm.
So, definitely helping with that is a big part, but also just, I have so many women who don't want to have kids, or are past having kids, and their hormones still wreak havoc in their bodies.
Hmm.
So definitely with menstrual irregularities, whether it be like really short cycles, or when
Hmm.
we're trying to regulate their cycles, PMS for sure, PMDD type
Yeah,
symptoms of, like, I can't recognize myself, like,
yeah,
a few days before my period, or even longer.
yeah. Or 2 weeks
Yeah.
with people with PMDD. Yeah, it's tough. Yeah.
Definitely, perimenopause and menopause symptoms as well, with,
Hmm.
low libido and vaginal dryness, and all the aspects that come with that, with weight gain, brain fog, all
Hmm.
the fun.
All the good, oh, I know all the fun things of being a woman. So, I know that you don't just use acupuncture, right? There's other aspects to Chinese medicine that are just as important, right? Or just as, yeah. So can you talk to some of those?
So I always, Chinese medicine is the umbrella.
Mm-hmm.
And there's also, there's Korean acupuncture and Japanese, and,
Mm-hmm.
different, but I studied Chinese medicine. So that's the umbrella. And then
Mm-hmm.
acupuncture is just one tool that we have of that
Leg of it.
umbrella.
Mm-hmm.
It's a big one,
Mm-hmm.
it's one that I rely on very
Mm-hmm.
much because it's so powerful, but that's just one part of it. We also work with herbal medicine, which is huge, and
Mm-hmm.
especially with hormones, because we're dealing with yin.
Mm-hmm.
Again, kind of everything is yin and yang, like with perspective. Yang acupuncture is very yang, because even when
Mm-hmm.
I'm nourishing yin with acupuncture, it's all about movements. And
Mm-hmm.
herbal medicine is yin, it's substance, in definition. So a lot of the times herbal medicine is huge with regulating hormones.
Mm-hmm.
We also have dietary therapy and nutritional therapy, and kind of the same concepts of like trying to diagnose yin and yang deficiency or blood deficiency, or these different organs that are involved, using food as medicine, which is
Mm-hmm.
obviously,
Mm-hmm.
major medicine or
Huge.
poison. And then we have like adjunct techniques like moxibustion, which is used a lot for hormones too. Moxibustion is a herb called artemisia or mugwort.
Oh, okay.
It's used internally in our
Mm-hmm.
materia medicus to stop bleeding and astringe the blood, but we also use it topically, and sometimes we have these like moxa sticks
Mm-hmm.
that you can like use over acupressure points, or there's these moxa cones. You can actually put like moxa directly over the belly,
Mm.
for digestive issues, but also definitely to help with cramps and menstrual irregularities. We have gua sha and cupping, essential oils. We learn just as we learn with food, with like each one that goes to specific organs and has
Mm-hmm.
different properties. So there's a lot of different tools, and
Mm-hmm.
we can kind of customize depending on what people need or what they would respond to the best.
Gotcha. Yeah. So I was actually just looking at a formula because it's interesting because I, haven't been trained in herbs, but know some particular herbs, whether they're Western or Eastern herbs for different hormonal situations. But I was just reading about this one formula for fibroids that
Mhm.
is white peony. Um, it was like unicorn something. I forget what I don't know if the other ones were Chinese herbs, but white peony is more of a Chinese herb, right? And there was something else in there, but apparently the four of those shepherd's purse maybe was in there. I don't know, but four of those that were supposed to be good for fibroids. But I was reading into it, and it's fascinating because on the one hand, they're phytoestrogens,
Mhm.
right? Which there's a big debate in, I'd say, the functional world of like whether phytoestrogens are helpful or hurtful when you have estrogen dominance
Mhm.
situation going on, right? Because the one theory is the phytoestrogens can replace or displace the xenoestrogens that are coming in from our environment or our own more toxic estrogen, essentially, but then the other side of the argument is that it's increasing the estrogen in our body. So it's interesting with reading with the white peony and some of these other herbs that are in there. It's like, oh, it can very much help with like blood flow and like, I think sort of like getting rid of that stagnation and those kinds of things, but then it also can kind of like feed your estrogen a little bit too. So do
Yeah,
you
we
see
have a
that
really
coming up?
cool, we have a
Yeah.
really cool textbook that's actually written. He's an amazing practitioner, herbalist, who is an acupuncturist, and I think he's a pharmacist as well. So he's got
Hmm.
a book that it kind of goes through like the Chinese medicine, like Bai Shao softens the liver, and it's
Hmm.
sour, and all the it tone of it nourishes the blood, these different
Hmm.
concepts, but then also how it like responds to more in the Western sense of like phytoestrogens and things like that. And
Hmm.
it's I do think taking those things into account is important. And that's when I think obviously working in conjunction with other practitioners and having like someone like you,
Hmm.
testing that and looking at that.
Hmm.
And then we would, like we have another one. I don't know if it's called Hushawu. Shoot, I forgot the um Is it,
The the American way of saying it.
yeah,
I
it's
think I've
one you
heard of it.
probably know of because
Yeah.
it's used a lot for, we use it for like premature graying of hair or hair
Mm.
loss, because that can be a blood and yin deficiency.
Okay, yeah,
So
that
it's
makes sense.
an herb that nourishes. But we've also learned that, like, if somebody, for example, has breast cancer or some estrogen,
Dominant, yeah, any
that you might want to be make note of that and maybe,
careful.
use something else. So I
Yeah.
think that's the beauty of like uncovering all of these
Yep.
different layers of things, to kind of be looking at it from different angles. But the way we were trained is that we treat what we see. So like we were necessarily, because we didn't have maybe those diagnostic tests, we have pulse and tongue to
Right.
look at the shifts of what's happening, then we would kind of rely on those more so.
Well, and I think that's really important too, right? Because I like even the phytoestrogen argument. I think it depends, right? It
Mhm.
depends on the individual. So if you're looking at their pulse and you're looking at their tongue and all these other diagnostic tools that you're using in the moment, that's going to tell you more, maybe than the testing that we do, like the actual blood testing or, urine testing, saliva testing. It's gonna tell you more in that moment because I think it depends on the moment too sometimes, right? So talk a little bit more about. I've always am curious with the pulse and the tongue and all of that. Like I'm always like, tell me what you see.
I always love it when I'm like feeling people's pulses and they're always like, can you not find it? Or, and it's like,
Yeah.
no, I'm checking it very differently. And,
Uh,
it's the reason I'm like playing the piano on it. It's just a different way of checking pulse. So, um, one of the things I love about the interrogation and palpation aspect of figuring
mhm.
out what's wrong with people is it does feel kind of like detective work. You have
Mhm.
to kind of figure out like, ooh, and I'm sure you feel that way too, of like, all
Mhm.
right, I'm
Oh
gonna put on
yeah.
well Dick Tracy hat and figure out what's happening here. So we use, questioning is a really big part of how
Mhm.
we diagnose. So, we'll go into like lots of questioning about a woman's menstrual cycle and the color of the blood and if they have clots and how long they're
Mhm.
bleeding for, and that all actually gives us information as to what's going on.
Mhm.
We'll talk about poops and all these different things to
My
really help.
favorite.
Yeah, I can talk poop all day long.
Yep.
Texture, does it feel complete, what's the
Yep.
color, all.
Give it to me. Tell me more.
I know when people are like, oh, and I'm like, no, no, no,
Yeah,
I
yeah.
want it
Yeah.
all. And the fascinating part about that is that that starts pinpointing us in different directions. And
Mhm.
one of the cool things is that we'll never take one symptom and just say, oh, that means that. Like,
Yeah.
oh, you have breast tenderness, that means you have chi stagnation. It could be, but you have to kind of take all these
Yep.
symptoms into accord and then be like, oh, that will mean this.
Mhm.
And then after interrogation, sometimes we'll like palpate the channels. That's a different way of
Mhm.
diagnosing too, to kind of like feel like there's a whole hara diagnosis, which is a Japanese form of like touching the belly and seeing areas that are cold or feel
Mm.
differently. That also gives us information and can be very helpful for hormones. But then we go into pulse and tongue diagnosis, which a lot of the times will like affirm and be like, aha, I knew it. It was
Mhm.
totally,
Mhm.
like
Ah.
the clue, like it was the candlestick.
You're like, I was right.
And other times it's like, huh, but it's pulse and tongue in a way don't lie. Like some of our
Mm.
symptoms sometimes can be, like I'll have people
Multiple
be like,
things. Mhm.
totally. And, some people will be like, oh, my poops are fine. And then
Mhm.
it's not until 5 treatments later that I'm like,
No,
I
they're
have
not.
diarrhea 5 times a day. They're not fine. Like,
Yeah.
so that's where pulse and tongue is really important. So the pulse, the way we check the pulse is that we actually check it at 3 different positions,
Mhm.
3 different layers
Okay.
on both wrists. So
Okay.
on your right side, and I'm going to show it to the people who are looking at the camera.
Mhm.
On the right side, you're looking at your lung, your
Mm.
spleen, and your kidney yang.
Okay.
And then you check it at the like what we call the Wei level, which is almost roughly translated as your immunity, but it's so much more. It's kind of like what keeps our pores open and closed.
Mm.
Can kind of see if like there's something floating at the surface. Then our yin, which is our blood or like nutritive level, and
Mm.
wan, which is almost like our constitution. So
Oh.
we're checking all those organs in all those different positions. So in school, we would have like those 9 boxes that we would have to, check
Mhm.
what we're feeling, and we have over 28 pulse qualities to describe the pulse.
Whoa.
So yeah, it's like learning an instrument. So it's like we'll have pulse qualities like thin, tight,
Mhm.
slippery, choppy. And you have to kind of start learning what these pulses feel like.
Yeah.
But each one of those pulse qualities tell us what's going on internally in those organs. So it's almost like
Mhm.
a little prehistoric MRI where, and like we've mentioned, there's
Mhm.
different ways of taking pulses. People take it differently. There's not just like,
Mhm.
this is the way you take it. But one of the cool things about the way I studied is that we also study communication pulses. So we actually will pump, for example, the lung and spleen. So the
Mhm.
spleen actually has to ascend to the lung. There's a lot of directionality that we're looking at. And a
Mhm.
lot of times people with lung deficiency, whether they have like asthma or a lot of congestion or shortness of breath, we could work on the lungs, but we kind of have to see if the spleen is ascending to the lung. And we can check
Mhm.
that via pulses to see if like the spleen is basically talking to the lungs. So there's
Mm.
cool um, things that we can pick up on. And then on the other side, you're checking your heart, your liver, and your kidney yin.
Okay.
Again, at all those different levels. So based off of what's happening in the pulses, we'll say like, oh, your kidneys might be a little bit deficient. So we really need to nourish the kidneys, or the liver's tight, we want to work on the
Mhm.
liver. So it's a huge diagnostic tool. And it's one
Yeah.
that, it's, yeah. And some practitioners are like freaking wizards at it, and
Yeah.
it's like
Yeah.
a lifelong learning it, because it's
Learning
very,
all those different ways of it being. I mean, just and like how you even teach that, right? I mean, I can think that that's so hard to teach and to learn.
yeah, like our teachers would, go around the room and like press pulses and be like, okay, this is a slippery pulse. And you really
Mhm.
go to that
Feel it
person,
real quick.
like, it's not. And
Yeah.
what I love too is sometimes you kind of make up your own pulse qualities in a
Yeah.
way, because it's almost like it is energy. So you're
Yep.
kind of like, oh, well, at first when I pressed the pulse, it felt very thin. But then when I almost like pumped it up a little bit, it came up. And that could mean that
Mm.
it's like thin, not necessarily like functionality, but more physiology. So it's,
Mhm.
like
Right.
it's
Yep.
not out of like necessity, but then it needs, if it can, it
Yeah.
will come up.
Give it a
So
little, yeah, give it a little
that's a lot.
loving.
The tongue also, I miss looking at tongues. Obviously, I don't look at tongues that much these days.
Right, right, right.
I do have patients sometimes take a picture and they'll show it to me, or
That's
if I
smart.
do any Zoom consults and things like that, I will look at the tongue. But the tongue, each area also corresponds to a particular organ. And then you have the overall shape of the tongue. Is it
Mhm.
swollen or is it thin? Like if it's thin, that's usually a yin deficiency, because there's not enough fluids to kind of make up your tongue.
Gotcha.
Or if it's swollen, it could be that there's a yang deficiency. There's not enough fire to kind of transform the fluids, or there could
Mm.
be some dampness. We look at the color. Is it pale? There's chi and blood deficiency. Is it red? There's some heat or
Mm.
inflammation. Is it purple? That means there's some blood stagnation. The coat, is it white, yellow, shiny, peeled in different area, geographic tongue, like all
Mhm.
that will tell us so much. Cracks, are they horizontal, vertical, where are they located?
Mm.
All of that will give us a lot of information as to what's happening in those organs. So
I
it's,
love that, I mean, this is definitely something that's not a part of Western medicine in general, is that our tongue, our nails, like all of these, extremities or whatever you want to call it, like can tell you exactly what's going on inside. Yeah. And it's like that's information that I think that we as human beings, intuitively knew or was passed down for a long time, and we've lost that in the past, couple hundred years. So that's why I think, I mean, Ayurveda is the same way, where it has those same, similar diagnostic tools and looking at those kinds of things, and it can tell you so much. Oh, what was I gonna ask? Of
with
course, now.
the tongue, it's cool too, because each, um, apart from Yin Yang theory, there's 5 element theory, which you can also apply across the board of like, each season is associated with a yin yang
Mm-hmm.
organ and a color, a taste, a sensory orifice. So it's interesting, like the liver, for example, opens up into the eyes, and
Mm.
the tissue associated with it is sinews and tendons, versus the kidneys are associated with the ear and are associated with the bone. So a lot of times people will come in and like have, let's say, have some degenerative bone disease, or and they also
Mm-hmm.
have ringing in the ears, and they have low back pain,
Mm,
and that, like, even though it seems it's all over the place, it's like actually those correspondences
totally.
correspond to those different organs, which is kind of
Connected.
cool.
I
Mhm.
love that. And I love that this working together and bridging those things, because I think that that's it's so important. Like it's so much of what I'm learning, I feel like, is based on these traditional approaches like Chinese medicine and Ayurveda and the things that were already discovered a long time ago, you know? And we're like, hey, look what we figured out. And you guys are like, look, we knew that a long time ago.
Let me
Um,
tell you something.
I did want to ask about the spleen,
Yeah,
because I feel like that's something that's talked about a lot in Chinese medicine that
so
you
much.
don't like. I mean, I kind of didn't really, I don't think I'd ever heard of a spleen before I saw an acupuncturist, you know? And so it's just not something talked about in Western medicine that much. So can you tell us a little bit about it?
Yeah, so it's, and again with those different schools of thought, there's like a whole school of thought in China that's called the Earth School. So the
Mhm.
Earth element has to do with the spleen and stomach, and that it's like kind of how you believe that a lot of hormone issues and issues are rooted in the gut. The Earth
Mhm.
School believes the exact same thing, that it's like you have to
Mm.
work on that spleen stomach because that is the foundation of
Mhm.
everything. And so the spleen is interesting because, yeah, in Western medicine, it's like some people don't have a
Yeah.
ruptured spleen and like you can live without one. In our view, it is translated as a spleen and stomach. A lot of people think that when they say the spleen, they actually just mean the whole digestive system. So
Mm.
it's not necessarily like a lot of the times when we talk about the organs, yes, we are talking about the actual physical organ because each, like the spleen channel goes directly to the spleen and the
Mhm.
stomach, but it's also more of like the function of it. So when we
Mm.
talk about the spleen in Chinese medicine, we're not necessarily talking about the organ,
The
we're talking
organ.
about the function of the spleen, which
Gotcha.
is one of the most, I mean, all organs have, it's like babies, you can't pick which one is more important,
Yeah.
but it's the spleen is responsible for transforming and transporting your food. So actually, like your stomach is like the cooking pot, and then the spleen is the fire underneath it. So it like transforms,
Mm.
transports, and all the food, like people with leaky gut or people with, digestive abnormalities, a lot of that is because the spleen isn't able to transform and transport, which then,
Mm.
like I mentioned, it has to go up to the lungs. It also can descend down into the bladder. So there's so much transformation that's happening within the
Mhm.
spleen that's foundational. And in our society, we tend to be a little damp, and that's
Mhm.
one of the patterns of imbalance that we diagnose. That's a lot of the times coming from a spleen deficiency. If the spleen
Mm.
isn't able to transform and transport, then things just kind of become sludgy, and
Mm.
then we have, a little bit of like lethargy or fatigue, heavy limbs, brain fog, weight gain, like slow metabolism. And that's all coming from that damp accumulation that we can drain the damp all day long, but we have to work on that spleen to be able to move it.
Gotcha. Gotcha. I feel like I've read a little bit about, in functional medicine or whatever, that the spleen is really important in terms of immune function too. And so I found it. I have all kinds of random things that have popped up for me, since my surgeries, right? I'm like, oh, what is this symptom all about? But one of the biggest things that started happening, I can't remember, sometime last year, was, I mean, I had already had some gum, what's it called? Uh, when your gums start to recede, right? I had some of that happening a little bit before my surgeries, but then post surgeries, probably a year or so after, like it's just started receding like crazy. And I was just like, oh my God, what is happening? And I did all the things. I'm like, you make sure I'm getting enough minerals, because with teeth and gums, that's such a big deal. And just trying to figure out everything. And then finally I think I was taking beef liver and then maybe the beef organs, which you can get as, supplements. Cause I'm
Mhm.
like, I can't eat that stuff straight up. And, I was reading about beef spleen has the highest amount of iron in it, bioavailable iron, right? And so many women struggle with low iron. I see it all the time. And then, iron supplements can be super constipating for people and just hard to take all the time. So I got into taking beef spleen, and like almost immediately my gums stopped hurting and stopped receding. And I
Yeah.
was like, What? Like, what about this? And then I was like, well, is it just an immune function thing for me? I don't know if it shows up that way or if it's, yeah, I have no idea.
I think, yeah, there's a lot to look at it there, and like a few different things came up, and I'm gonna try to remember all the things, but like kind of how I talked about each organ has a different, like the liver is the eyes, the
Hmm.
spleen is actually the mouth. So that was the first correspondence.
Mm.
I'm like, okay, there's something there. And the spleen, also responsible for transforming and transporting, is really responsible for making your blood in Chinese medicine, because
Mm.
it's like that's how we make blood, is through transforming and transporting.
Mm.
Um, the liver holds it,
Mhm.
the heart governs it. There's different organs
Mm.
involved with blood and blood production. And but for example, people with like early periods, a lot of the times that's actually spleen deficiency, because the spleen is responsible for holding the blood. And a lot of times,
Mm.
if there's like too much bleeding or too early bleeding, miscarriages, a lot of the time is a spleen deficiency, because it's
Oh.
not holding properly. But it's one of those things that with dietary therapy, a lot of the times, kind of again with that excess deficiency, like a lot of times when people do have deficiency, like blood deficiency or anemia, and sometimes it might not show up that way, we want to nourish the blood. And what better way than like the actual organs? Like a lot of times
Yeah.
people be like, oh, meat is very, can help produce blood, but it's like, yeah, but you're really wanting to do like more of like the livers and the hearts and the spleen, because that's actually more not like the flank. And I'm a vegetarian,
Right.
so I'm like, I don't even know
Yeah.
the
The
I
term.
go pick out meat for my wife at the grocery store, and I'm like, what is all this fat? I don't know. Um, but it's interesting how that I could see how it definitely, and this, and I'm trying to think if that corresponds to like the kidneys have to do with the bones, the spleen is muscle. So I'm thinking
Mm.
maybe, that also has something to do
Showing
with
up
the
in that
bones.
way. Yeah.
So,
It's just so fascinating, right? Because that was one of those situations where I was just like, who would have ever thought, like, for me, I'm like, the spleen is going to be connected to my gums, and that may not show up in everybody that way, but that's how it showed up. And I was very glad to be able to figure that out. I can't remember if I figured it out via muscle testing or what was going on, but I was just like, give me that spleen. And it's been super helpful. And I just can't run out of it these days. So I'm like, it still needs support apparently, but um,
they're putting spleen supplements in their Amazon cart right after.
exactly. Absolutely. Everyone's like, ding, ding. um, oh my God, there's so many more questions I could ask you, but
Yes,
we're everybody's like, okay, this is so much information I've taken in.
we'll
This
just
was
take it
amazing.
ourselves.
Yes, yes. This was so amazing though. Like, thank you so much for coming on and explaining it. Like, it illuminated so much for me. And I am assuming it illuminated a lot for a lot of other people, just like starting to make those connections and really knowing how acupuncture can help, like I said, with so much more um, than your arm hurting. Not that it's bad for those things, but it's so helpful to do it consistently when you have some kind of chronic issue going on. I mean, what would you recommend for people in terms of like if they do have a chronic issue, how often they should go?
So, a lot of the times when somebody comes in the first time, we'll do the whole consult and needles. And, I have a little spiel that I say, but I mean it. And it's
Hmm.
very true that people do respond to acupuncture very differently. So after the first treatment, that actually does give me a lot of info as to, how you're going to
Mm-hmm.
respond. And,
Hmm.
we have like, for example, the longer you've had something, the longer it takes to treat, or, kind of the analogy of like, it's like peeling layers off of an onion, where it's
Yep.
like, things can start coming up, and then we really get to that root cause, which so much of our medicine is trying to figure out. Yes, you might have, amenorrhea, but why is that happening? And like
Hmm.
kind of fixing it from the root is absolutely what we're trying to do. So a lot of the times, like I have most of my patients now are like once a month, like
Hmm.
their maintenance, they've, gone through treatments and they feel really good, and they come in every 4 to 6 weeks as like little tune-ups.
Hmm.
And that's when things are going well in the world, which, and in our lives, which, doesn't always happen. So
Hmm.
maintenance is different times, just like my therapy.
Yeah.
Sometimes my therapy is like every week, sometimes it's every month, depending on, what's happening.
Hmm.
But a lot of the times what I like to do is treat people once a week
Hmm.
for like 4 to 5 visits, depending.
Makes sense.
And then once they start noticing all their symptoms shift, and, with menstrual irregularities and hormones, I do like to work with women for 3 months, because that's
Hmm.
such a foundational. And we talked about this a little bit in our Instagram live,
Hmm.
how we're working on the Jing, which is that constitutional yuan qi, which has a lot to do with your kidneys, which has a lot to do with your reproductive health. So 3 months is great. I always try to make it work with my patients. And like, if they can only do every other week or once a month, herbs, and again, a lot of the lifestyle,
Yeah.
nutritional recommendations can keep the medicine spreading, but ideally once a week and then once a month, or depending, like if people are coming in with, acute pain, like in China, sometimes they'll treat every day,
Yeah.
a
Till it
few
calms
times a week.
down.
And so it kind of depends on how people respond and what they're needing, but either every week or every other week or once a month, or some people come in for little seasonal tune-ups. So
That makes sense.
yeah.
And for those of you that don't know, that didn't have a chance to listen to our IG live, we are actually combining forces, and we have, I know, so we have a program for people that are local to Asheville or Western North Carolina, upstate South Carolina. If you're willing to travel from elsewhere, you can come. But basically, we've combined using functional health and acupuncture and Chinese medicine in order to support you on your hormone journey. So anything from, stuff we've talked about today, fertility stuff, fibroids, perimenopause, menopause, all PMS, PMDD, all the good stuff that's
OS,
out there.
endometriosis.
Yes, all of it.
Mhm.
And we decided to do this together because, as I've sort of been saying throughout the time, and we've both been saying that it's just so helpful to bring both sides of the equation, or two of the sides of the equation. I don't know if there's probably multiple more, but to really support healing on a different level, right, is bringing in all of this information, because I think bridging the worlds is, a
Mhm.
much smarter idea to do than continuing to keep them separate. And so what we get a chance to do is, do hormone testing so we can see what things look like in that sort of concrete way, and then doing the acupuncture and all of the diagnostics that Ashley's talked about today to work with those energy systems on a level that you can't just do from the hormone testing. And so then we sit down and create a plan for you, a plan of action that includes everything from food to nutrition, supplements, herbs, etc. And you get to see Ashley 3 times over our program together. And it's amazing, like, what can happen when you bridge those two worlds and offer that to people. So if you're interested in learning more about that, you can go to my website, christinegarvin.com. There's all kinds of stuff on there about it. You can also shoot me an email, or Ashley an email. And you want to tell people your website?
Yes, it's eastacupuncturewb.com. And I think under Instagram and Facebook, it's East Acupuncture Wellness.
Nice. So if you are in the area, go check the place out. Even if you aren't going in for acupuncture, there's this beautiful boutique of amazing, like, all hand picked, right? You've picked all of this stuff yourself, like super high quality everything, from like candles to um all kinds of body products, like really good stuff. I'm like
Well,
always excited when I go in there.
one of the things that, as you talk a lot about, like helping with endocrine disruptors, like so many of my patients either going through cancer, fertility, like we talk about cleaning up their skincare or cleaning up their, home good products and their
Mhm.
toxic cleaning products. So part of the wellness boutique I created was to kind of have a space for people to have options and really continue their health journey and make it fun. So like whether
Mm.
it be skincare or teas and soaps, just things that,
Yeah.
can inspire people in their wellness journey and make it a little fun versus like,
Just like, yeah, like, oh, I have to cut all this stuff out. It's
no, like
like
it's
you're
fun.
offering like the good stuff that's in, replacing. And it's online now too, right? You have an online
Yep.
shop
Mhm.
also.
Yep. Mhm.
So even if you're not in the area and can't go into the shop, you can check it out online and order stuff from there. So do
And
it.
most of
So
all our products are woman owned, which was like kind of a coincidence. And when we looked at it, I was like, oh, that's so badass. Like,
you're like, hells yeah.
yeah.
I love it. Well, thank you so much for coming on today.
Thank you for having me. It was one of those things that I'm like, oh, what am I going to talk about? And I'm like, there's so much more I wanted to say. And I hope, yeah, the
Yeah.
takeaway is just that this medicine is so powerful and beautiful. And there's so many other medicines out there, but just finding people who support you in your health journey, I think is huge.
Is
And I'm so
key.
grateful for what you do for our community. So thank you for having
Absolutely. So good. All right, you guys, I will see you next time.